Thank you, Madam Chair. And thank you so much again for having this hearing. I think this is just a powerfully important point. And I commend you and Senator Casey for pulling this together and everyone for coming today. We all understand that nutrition is vitally important for health. So is access to health care. And if someone isn't getting adequate nutrition or can't afford to go to the doctor for preventive care, it's not just bad for the person, it's expensive for the system. In Massachusetts, we have been working hard to keep health care costs low by focusing on both sides of the equation, on nutrition and near universal health care coverage. Tufts has a world-class research center where researchers study the links between nutrition and healthy aging. Our community health centers partner with local food banks and with grocery stores to improve access to nutritious foods. They have some really creative programs. I've visited several of them. And our new state Medicaid waiver now incentivizes healthcare providers to keep people healthy by including providing nutrition services. So, Dr. Berkowitz, you've done a lot of research studying the links between food and health. Can I ask you, how do programs like SNAP or meal delivery impact health care costs for older adults?
So thanks for that question. I think what we're learning is that they have a very positive impact on healthcare costs, meaning that they reduce costs, and they do it in sort of the way we want to as well. Healthcare services cost money, whether that's a primary care visit or an emergency department visit or an inpatient admission. But I think we'd all rather spend the money on prevention, spend the money on keeping people healthy, and not have it turn into a complication or a crisis. And what we see is that not only do programs like SNAP or meal delivery reduce healthcare costs, they do it by reducing these big ticket items like inpatient hospitalizations or emergency department visits that usually signal something has gone wrong.
Right. Now, I know that one of your research studies, you looked specifically at how meal delivery lowered health costs for low-income seniors on Medicaid. So what would happen to seniors receiving food assistance if their Medicaid benefits were taken away? Would the meal delivery program be enough on its own to keep them healthy and out of the hospital?
So I would say it's not. First, the program really came as part of their Medicaid benefits, so it is part of in a very innovative health insurer in Massachusetts, Commonwealth Care Alliance, who made it a covered benefit. So it's not even clear that the program itself would continue without Medicaid. But even if it were to, for some reason, these are programs that work hand in hand with health care. Nutrition is an important part. Seeing your doctor is an important part. Seeing your nutritionist is an important part. Taking your medications are an important part. These all go together, and I don't think there's any one thing on its own that's going to keep people healthy. Just like just seeing your doctor won't keep you healthy without nutrition, just having the nutrition without being able to see your doctor or afford your medications is not likely to keep you healthy either. So I think this really all goes together.
Yeah, I really appreciate your emphasizing the importance of the integration here and how many low-income seniors rely on Medicaid to be able to stay as healthy as possible. Ms. Taylor, you and your husband have raised 10 children, 5 of them adopted. Congratulations. I know that food assistance has helped you make ends meet, but I want to ask you about another program that I think has helped a lot, Medicaid. I understand that several members of your family receive Medicaid benefits. Can I just ask, Ms. Taylor, if your children and grandchildren's Medicaid benefits were taken away, what would that mean for your family?
This is a very important part of my adopting 5 special needs boys, because part of the adoption package was that they would receive Medicaid till they were 18. Mm-hmm. I couldn't, by working, both my husband and I, again, all our lives, be able to afford health care, especially with special needs. You know, I have one child who genetically, his teeth were falling out. It was a genetic problem. The dentist called it aesthetics, so it had to come out of pocket. Mm-hmm. You know, it's those kind of things that you pay for, but if I had to do the whole total caring or coverage for these children, I wouldn't be able to take care of them. So that not having Medicaid in my situation would impact them because I couldn't adopt and not be able to take care of 5 special needs boys. It will impact the foster care system tremendously. They're crowded now. They're begging for families. You know, it's powerful. I have my one daughter that I brought with me today. She has taken, her godmother gave her a Down syndrome's child who's 96% blind. His life expectancy wasn't supposed to be to 10 years of age. He's 22 now. It's necessary. She works. You know, she couldn't afford his needs to be met just by working alone. Where would he be? He would be a burden on the system in some facility. You know, it's important, you know, not in all cases. My husband and I, you know, we've worked, we've paid our dues, but in some cases, there's people who can't. They just can't, and it's important that those needs be met.
Well, thank you very much. Thank you for all you've done. You've made a real difference in the lives of a lot of people. And I just appreciate all of the work you're doing and the importance of health and nutrition here and how they go together. Thank you, Madam Chair.
Thank